Hi everyone, Cheryl Koehn here with the hashtag #CArthritis broadcast booth of the Arthritis Broadcast Network. I can't believe it, but I'm going to say this is our last and final interview at this year's Canadian Rheumatology Association and Allied Health Professions Association meeting. And it gives us great pleasure, of course, how clever were we, to have the conference planning chair be our last interview. It was basically a fluke, but we're glad that it worked out this way, Tom. So this is Dr. Tom Appleton. He's a very talented rheumatologist. He's also a clinical researcher and assistant professor at Western University. So we're very happy to have you here, Tom. Thanks for being patient as we got through our 38th interview. And we're so happy to have you here because we think the right way to end our time here broadcasting at the CRA meeting is talking to you, the conference chair, about the theme that you chose, precision medicine. We've been weaving the theme throughout all of our interviews in the last 72 hours, and it's been really interesting hearing your colleagues' perspective from their different professional sort of angles and interests. And we'd like to hear why you chose precision medicine this year versus last year or next year. What drove you to making that decision as a planning committee?
Right. Well, first of all, thank you for having me here,
Yeah.
and it is a pleasure. Honestly, I think the hashtag #CArthritis campaign is great, and I can't believe that you've been through 38 of these so far. So kudos to you for making this happen.
Thank you.
Yeah, I mean, I think one of the main reasons we decided to do precision and personalized medicine this year is because it hasn't been done before.
Yeah.
And it really reflects where things have come, and as you know, it's been an incredible explosion of advancements in diagnostics and therapeutics in rheumatology in the recent era.
Yeah.
But also, there's so much on the horizon. You know, there are incredible advancements in machine learning and artificial intelligence that are out there in many sectors, and they're just starting to crack into healthcare now.
Yeah.
And so we're hearing that all the time from patients are asking about it in clinic. Clearly, a lot of our research that's going on is being driven by big data kind of studies. We're seeing a lot of advanced tools like omics kind of work that's going on. Biomarkers are being done in much higher throughput kind of assays. And also we're getting deeper insights too into how patients' clinical presentations are being presented because we're able to analyze data in a lot more sophisticated ways. So, we take all of those things into consideration, and we really think that precision and personalized medicine can be put together very nicely and advance the care for patients. So that's what we were motivated to do, and we've been thinking about this for several years to bring it along, and there have been other great themes, but this was the year.
Yeah, what I am thankful for in terms of your choice of theme this year, having been in the community a long time, is, as you point out, patients living with other diseases have seen their specialists focusing on precision medicine. I'm thinking of cancer treatment in particular, and so much is written about cancer and gene therapy now, and all of the very cool science. And rheumatology has that science too, or maybe not far behind. So for us patients, it's so encouraging to hear you aim high. And that's sort of, to me, what I think precision medicine is all about. We're aiming high to get the most control over disease, or to get the best answer to a patient's question when it comes to therapy or even non-pharmacologic therapy. So thank you, actually, from all of the patients out there that are in our Facebook and Twitter sphere. We really appreciate that advancement, that forward thinking, and it's almost a modernity about the approach that the CRA is taking now, which is really nice, very contemporary. I wanted to ask you, so as someone who was a leader in planning the conference, and you chaired, I know, a number of sessions and were stretched very thin this year, you also had a chance to participate as a member and listen to some of the presentations, obviously, and when you think about the last 2 days and the science that was presented, what for you are the key takeaways? And how should they matter to patients, actually? Make it even tougher question.
Yeah, no, and it is the right question, because I think if we're we're bringing content to the meeting, we want to make sure that it is relevant for
Yeah.
patients. I mean, that's why we're here,
Yeah.
right? We're here to advance care. We're here to bring the best knowledge that we can to all of the CRA members so that they can take that away with them and incorporate it in their own practices.
Yeah.
At least that's the hope, right? And,
Yeah.
and that happens in an iterative way over time. So there have been a number of fantastic sessions so far, and we the best laid plans happen in advance of the meeting, but it is up to everyone who comes and presents, and people have done a fantastic job this year as they do every year. Some things that have been fantastic, I think, were the keynote address on Wednesday night with Dr. Linda Lee.
Yeah.
She was talking about wearables, and being able to incorporate measures of activity. And one of the interesting things that has really come through in recent years is the fact that the patients with arthritis are modulating how their symptoms are progressing or how they control them based on how much activity they do. So you might feel like you've had an improvement in your pain overall because of an initiation and treatment, and so your activity will actually increase. And that may actually cause an increase in pain as well, which come via studies, right? So that's a big factor.
Yeah.
But also that fact that you've been able to increase your activity overall is a win.
Yeah.
That's a big improvement in quality of life. And we hear that from patients all the time. And I think that the fact that that kind of thing is being incorporated into studies now and advancements in tools like Dr. Lee was talking about that are available are really exciting changes in the field that will start to become commonplace in pretty much every study. So that's new and exciting.
Yeah.
Other things that have been really exciting to see are the trainee presentations. I mean, they're the future of rheumatology in Canada.
Says the young kid on the block.
Well,
I love it.
Yeah, I know, but it's there. People are coming along all the time, and one of the most incredible things that drew me to rheumatology in the first place many years ago, when I kind of decided this is what my goal is going to be, was this community of senior and established rheumatologists who were so supportive, so enthusiastic about mentoring younger people and creating training opportunities, and never feeling threatened about people coming along and having success. It's a win for the field. It's good for patients. It's good for the field overall, and it's just so encouraging to see our trainees doing so well. And we've had great presentations by people both in biomarker areas and in even qualitative research that's coming through now. That's been very exciting.
And you make a very safe environment available to them, I might add. That, I took in the poster sessions, and to see the mentor and the mentee standing at the posters is really important, because they need, it's like training wheels, kind of. The trainees need training wheels, and you're kind of those training wheels for them. You give them the confidence to stand and present amongst, their senior peers is not always easy. And I think you guys do make it really easy for them, which is great.
People need a safe environment to flourish in, right? And people do their best when they feel like they can be themselves and bring their best and not feel like they're being scrutinized. So, so it is great to see that,
Fantastic. What about, I'm going to put you on the spot, I'm pretty sure you participated in this session, the talk given by Dr. Ranjani Thomas. Exciting, obviously.
Sure.
How do we vaccinate to prevent a disease like RA, for example? What were your thoughts on that whole piece? I mean, she's leading, I think, in many ways the world in thinking about vaccinating for RA. Where do you think she is from a rheumatology perspective?
Right. So we were very excited that she accepted our offer to come and be a keynote speaker at this year's meeting. And Dr. Thomas laid out very nicely the last 20 years of her research program that she's been developing and building, and it's amazing how long it takes to really bring an idea from discovery through development and implementation. But I think it really is emblematic of what the theme of this year's meeting is about being able to precisely treat a condition. A lot of the developments that have happened in treatments that have been very effective for our patients with rheumatoid arthritis. That was her disease, but we've had other diseases that have had great improvements as well. They're still somewhat general in the case that you're targeting a mechanism that's sort of common to multiple forms of arthritis. But in the work that Dr. Thomas is doing, she's really talking about cure. She's really talking about that holy grail that we've been after for so long. And it's, you know, we're not there yet,
Yeah.
but it's so exciting and inspiring to see people doing work that's allowing us to have insights in a very specific way that we might be able to say, this patient is going to need this specific treatment one day in the future, and it's gonna cure their disease. So, yeah.
It's hear the word cure, and you know, as a patient myself, the hair on the back of my neck stands up, right. And you know, you get butterflies in your stomach, and not. I mean, I well realize it might not happen to a patient of my vintage, and you know, the mortality left for me. But I think about the next gen, and the hope that that we will have that type of technology available. So thanks again to the CRA for being so clever as to somehow convincing her to come all this way. I know she's based in Queensland. She actually was my rheumatologist when I lived in Queensland for a short period of time.
Is that right? Oh, I didn't know that, Cheryl. Oh, my goodness.
Yeah,
wow.
So it was really nice to see her. Thank you for flying her out here so that I could visit with her.
Well, we didn't just do that. We brought the meeting right to the edge of Canada.
Of course, and thank you for that, too. I guess lastly, I sort of wanted to know your thoughts about future. You know, when you're a practicing rheumatologist, you're also a clinical scientist, researcher. You obviously have taken a really important leadership position in the CRA, volunteering tons of, you know, I'm sure what is an abundance of free time, right? What do you see in the future? Like you know, you have lots of practice years left. What do you want to be able to see and say to your patients in 10 years?
Well, I mean, I think our vision is you know, in the long term, a world free of arthritis and free of autoimmune diseases, and that's a long way off. Yeah. But in 10 years, I think we'll have made incredible improvements in where we are so far. And if the last 10 years has been any indicator where we'll be able to progress to, I think there's a lot to be hopeful for. Yeah. You know, hope is such an important thing. Yeah. Ability to look forward. So, yeah.
Thank you so much. What a nice sentiment.
It's a pleasure.
It's really nice. Anita, do we have any questions from the audience?
What is your elevator pitch for a student who is considering a career in the field of rheumatology?
Oh, great question. 30 seconds, dude. Lay it on them.
There isn't a better choice that you can make. Rheumatology it's the best of all worlds because you've got incredible technology advancements and you've got the best of being a clinician, being able to have relationships with patients and change people's lives. Couldn't make a better choice.
Well, I'd say that's a darn good answer. Sold. You're going to get probably marketing job offers now as a result of this interview. Be prepared for those. Are we good, Anita? Perfect. The crowd's gone crazy. Thank you so much, Tom. It's really always a pleasure talking to you here, and we hope to see you back next year.
Thank you, Cheryl.
Thank you.
It's a pleasure.
Yeah.